please introduce yourself to our viewers and tell us a little bit about yourself.
Well, first of all, my name is Tom James, and I am a police officer, and I've been a police officer for 28 years. Throughout my service as a police officer, I've been involved in a lot of different altercations, motor vehicle accidents. As a result, there's been a little bit of a toll on my body. I first came here when I was suffering from PTSD, and I was going through some counseling in order to deal with some of the traumatic scenes that I've seen in my service.
I understand you had an accident, and whenabouts was that?
In the middle of the summer, my wife and I had the misfortune of having a mechanical failure on our motorcycle, causing the motorcycle to pitch us from it, and we received some extensive injuries. Those injuries included, for myself, shattered clavicle, was broken in 3 large pieces and a whole bunch of little ones, 8 broken ribs on the left side, including a fail, double puncture into my lungs, so I had deflated lungs, and then of course the regular road rash and bruising associated with coming down hard on the roadway.
Did you suffer any lasting effects?
The lasting effects are, with these type of injuries, of course, is the nerve damage. The shoulder, the clavicle itself, took a long time to heal, and it's now stacked. So the bones didn't heal end to end, they actually stacked upon each other. So there's added pressure on the nerves that run in the shoulder and down the arm. And we're still waiting to see if conventional medicine can assist with that, or if they need to assist with that.
I understand about 4 months ago you started a new therapy. What was that therapy?
Well, the therapy was the LED light therapy. It was introduced to me, and I wasn't sure about it, so they said, okay, try it and see what you have for benefits. And part of those benefits, probably 2 weeks into it, I was noticing slow progression. Most doctors said the injuries I sustained, it was going to take up to 18 months before I'd be healed. We're not even at a year yet. We're only into 8 months. So I've come a long way in 8 months. So something has happened in the past 4 months, 5 months, in order to get me this far. I still do conventional, therapies, including physiotherapy, and I'm also doing rehabilitation therapy, helping with the strengthening, because everything after the accident was severely damaged on the left side.
Tell us your experience with LED light therapy.
When I was first introduced, it was, okay, we're going to put on some lights onto your body. And I'm going, okay, how does this work? Think of it as like sitting out in the sun in a tropical environment, and you have that warmth penetrating into your body. I was also wearing the light mask, so it was, again, eyes. Even when you're closing your eyes, it's very bright, warm, and soothing. So when you're sitting there, it doesn't require you to do anything else but sit back, try and relax. So it helps relieve the tension. I understand it also helps with the inflammation. But again, for 35 minutes, 40 minutes, it's just nice to sit and relax.
How often do you come for sessions?
When I first started, I was coming once per week. So the session would last about 30 to 40 minutes.
How many sessions did it take before you noticed results? And what were those results?
Well, the results after it was about 2 sessions, I noticed that I didn't require as much painkillers, and also my mood was improving. With that change in progression of just the sessions, again, it was that warm feeling when you have the sessions, and you were much, much more relaxed. And again, that helped with the tension that I was feeling in the shoulder. So after the warmth and everything else, and it all relaxed, of course, the soreness also dissipated. By the end of the following week, of course, everything would be tense again, but you come back and it would help with the relaxation.
Would you recommend LED light therapy to others, and why?
I was a skeptic when I first was brought in. I was very much conventional medicine, expecting the pills as well as the, what's the alternative? Oh, surgery. So coming in and actually trying this was a new experience for me, and the effects of actually sitting down, having the LED light pads placed on your body, having the warmth, relaxation for that session allowed me to relax, reduce the pain, and allowed me to, I guess, cut back on traditional medicines that way. I still have my physiotherapy, my rehabilitation therapy, but in incorporating all of these three, again, my progress has been much more, I'm going to say, rapid than what was originally anticipated. They originally told me it was going to be 18 months before I would be considered, back to normal. And it's already been only 8 months, and I'm getting very close to where I was before. The sensory nerves in my left hand, the ulnar nerve, it's coming back. So that is a good sign. The damage that was done, as the neurologist told me, he says, the damage that you had in your nerve system, it only repairs at a millimeter per month. So don't expect fast results. Well, we're 8 months into it, and you know what? It's a lot better than where I was when I first started. Looking at this, if somebody is in a position where they have inflammation, soreness, this is another avenue that you may want to try, especially if you have a chronic disease or a very serious injury. The results for myself, it has, in my opinion, been an effective, I'm going to say, a therapy towards my healing. So if it works, why not use it?
Thank you for coming, and we'll see you again soon.
Thank you.